Over 1.3 billion people worldwide suffer from high blood pressure. Most of them have been told they'll need blood pressure medications for life. But here's a shocking truth. Natural treatments exist that can normalize blood pressure without medications, and their effectiveness has already been proven by numerous studies. By the end of this video, you'll discover the secrets of natural blood pressure treatment that even doctors find surprising, and learn methods to maintain healthy blood pressure without depending on medications. The hidden truth and side effects of blood pressure medications. Blood pressure medications only suppress symptoms, without addressing root causes. The more serious problem is the side effects that appear with long-term use. Diuretics cause electrolyte imbalances, ACE inhibitors trigger dry coughs, and calcium channel blockers cause swelling and dizziness. According to recent Harvard Medical School research, 68% of patients taking blood pressure medications for over 5 years experienced liver function decline, and 45% showed kidney function deterioration. Even more shocking is that blood pressure medications artificially lower blood pressure while reducing blood flow to the brain, increasing dementia risk. So what's the alternative? Restoring our body's natural blood pressure regulation ability. First treatment: potassium's amazing blood pressure lowering effect. Potassium is one of nature's most powerful blood pressure lowering components. However, 90% of modern people are potassium deficient. Potassium works opposite to sodium, relaxing blood vessel wall tension and naturally lowering blood pressure. In a large-scale study published by the American Heart Association, the group consuming 3,500 milligrams of potassium daily showed an average decrease of 11.2 millimeters of mercury systolic and 5.8 millimeters of mercury diastolic blood pressure after just 12 weeks. This effect is similar to common blood pressure medications. Potassium-rich foods include bananas, avocados, spinach, potatoes, tomatoes, and melons. One banana contains about 400 milligrams of potassium, so eating about 3 daily can provide significant blood pressure lowering benefits. But more important is the synergy between potassium and magnesium. Second treatment: magnesium's vascular relaxation miracle. Magnesium is called a natural calcium channel blocker. It relaxes vascular smooth muscles, reducing vascular resistance and lowering blood pressure. 75% of modern people are magnesium deficient, which is one of the hidden causes of hypertension. In research from Kyoto University, Japan, the group taking 400 milligrams of magnesium daily for 12 weeks showed average decreases of 8.7 millimeters of mercury systolic and 4.3 millimeters of mercury diastolic blood pressure. Even more remarkable was that magnesium achieved these effects without the side effects of blood pressure medications. Magnesium-rich foods include nuts, seeds, dark leafy greens, whole grains, and dark chocolate. 30 grams of pumpkin seeds contain 37% of daily magnesium requirements. Magnesium also reduces cortisol, the stress hormone, making it effective for stress-related hypertension. Third treatment: omega-3's vascular protection ability. Omega-3 fatty acids improve vascular endothelial cell function and reduce inflammation to lower blood pressure. Especially EPA and DHA components increase vascular flexibility and prevent arteriosclerosis. In a meta-analysis study from University of Bergen, Norway, groups consuming over 1,000 milligrams of omega-3 daily showed average decreases of 4.5 millimeters of mercury systolic and 3.1 millimeters of mercury diastolic blood pressure. This effect was more pronounced in middle-aged people over 55. Omega-3 rich foods include fatty fish like salmon, mackerel, sardines, and tuna. Plant-based omega-3 sources include flax seeds, chia seeds, and walnuts. But here's an important question. Have you ever heard about these natural treatments from your doctor? Most likely not. Fourth treatment: garlic's powerful blood pressure lowering action. Garlic has been used as natural medicine for thousands of years, and modern science has clearly proven its effectiveness. Garlic's active component allicin generates hydrogen sulfide to relax blood vessels and lower blood pressure. In research from University of Adelaide, Australia, the group, taking 600 to 900 milligrams of garlic extract daily for 12 weeks, showed an average systolic blood pressure decrease of 11.8 millimeters of mercury. This effect is superior to many blood pressure medications. To maximize garlic's blood pressure lowering effect, crush fresh garlic and let it sit for 10 minutes before consuming. The crushing process maximizes allicin production. About 2 to 3 cloves daily is appropriate. Garlic also lowers cholesterol and inhibits blood clot formation, providing excellent cardiovascular disease prevention. Fifth treatment: celery's amazing vasodilation effect. Celery contains PHT halides that relax vascular wall, smooth muscles, and lower blood pressure. This component also suppresses stress hormone secretion, making it especially effective for stress-related hypertension. In research from University of Chicago Medical School, the group consuming 4 celery stalks daily showed an average systolic blood pressure decrease of 7 millimeters of mercury within just 1 week. More remarkable was that this effect was sustained. Making celery juice is the most effective method. Drinking 250 milliliters of celery juice on an empty stomach in the morning helps maintain stable blood pressure throughout the day. Celery is also rich in potassium and magnesium, providing synergy with other minerals. Sixth treatment: hibiscus tea's natural diuretic effect. Hibiscus tea acts as a natural diuretic, eliminating sodium from the body and lowering blood pressure. Unlike diuretic blood pressure medications, it provides natural diuretic action without electrolyte imbalances. In research from Tehran University of Medical Sciences, Iran, the group drinking 3 cups of hibiscus tea daily for 6 weeks showed average decreases of 13.2 millimeters of mercury systolic and 6.1 millimeters of mercury diastolic blood pressure. This effect was superior to some prescription diuretics. Hibiscus tea is rich in anthocyanins, providing excellent antioxidant effects. About 2 to 3 cups daily is appropriate, but drinking too much can lower blood pressure excessively. Cold brewed hibiscus tea is especially effective for blood pressure management during hot summer months. Seventh treatment: coenzyme Q10's cellular energy recovery. Coenzyme Q10 is essential for energy production in cellular mitochondria. 80% of hypertension patients are deficient in coenzyme Q10, which causes heart function decline and blood pressure elevation. In research from University of Copenhagen, Denmark, the group taking 100 milligrams of coenzyme Q10 daily for 12 weeks showed average decreases of 17 millimeters of mercury systolic and 10 millimeters of mercury diastolic blood pressure. This is one of the most outstanding blood pressure lowering effects for a single component. Coenzyme Q10 is especially important for people taking statin cholesterol medications, as statins suppress the body's coenzyme Q10 production. Food sources include heart, liver, broccoli, and spinach, but content is low, so supplementation is more effective. Eighth treatment: deep breathing's nervous system regulation. Deep breathing activates the parasympathetic nervous system to naturally lower blood pressure. It has immediate and sustained effects, especially for stress-related hypertension. In research from Hiroshima University, Japan, the group practicing deep breathing for 15 minutes daily for 8 weeks showed average decreases of 13 millimeters of mercury systolic and 7 millimeters of mercury diastolic blood pressure. The most effective method is 4-7-8 breathing. Inhale through the nose for 4 seconds. Hold for 7 seconds, then exhale slowly through the mouth for 8 seconds. Repeat 4 times, 3 times daily. This method can be done anywhere and used as emergency treatment when blood pressure suddenly rises. Synergy effects and combination methods. These natural treatments are effective individually, but create more powerful synergy when used together. Potassium and magnesium balance electrolytes, omega-3 and garlic improve vascular health and breathing techniques. Provide immediate blood pressure control. The recommended combination includes morning celery juice with omega-3 supplements, garlic-containing foods at lunch and dinner, afternoon. hibiscus tea, and deep breathing before sleep. Consistent practice of these methods can show significant blood pressure improvement within 4 to 6 weeks. Precautions for medication reduction and medical cooperation. No matter how effective natural treatments are, suddenly stopping blood pressure medications is dangerous. Always consult medical professionals and gradually reduce medications. Generally, after blood pressure stabilizes with natural treatments, discuss with your doctor to reduce medication dosage by 25% increments. Regular blood pressure monitoring is essential during this process. Patience and consistent practice are crucial. Natural treatments aim for long-term, stable blood pressure normalization, rather than immediate effects. Essential lifestyle improvement elements. Certain lifestyle habits must be improved alongside natural treatments. Most important is limiting sodium intake. Restricting daily sodium to under 2,300 milligrams provides average blood pressure. Reduction of 5 to 6 millimeters of mercury. Regular exercise is essential. Aerobic exercise 3 times weekly for 30 minutes. Each lowers systolic blood pressure by 4 to 9 millimeters of mercury. Walking briskly, cycling, and swimming are particularly effective. Stress management is also important. Meditative activities like meditation, yoga, and Tai Chi reduce stress hormones and lower blood pressure. Your health is something you create. If you believe in and practice nature's healing power, a healthy life without blood pressure medications is possible. If this information was helpful, please hit the like button and subscribe with notifications for more health information. We sincerely support your healthy transformation.